Seventh nerve has motor nucleus, nucleus nervi facialis, which makes on the surface of rhomboid fossa colliculus facialis. This is motor fibers. Sensory nucleus is nucleus solitarius here, nucleus solitarius, and parasympathetic nucleus salivatorius, help me, superior. This is parasympathetic fibers. And facial nerve goes into, it goes to porus acousticus internus and then continues into facial canal, canalis facialis. This facial canal makes geniculum canalis facialis. Then another turn and opens with foramen stylomastate foramen. I draw this way. That is number 1 nucleus nervi facialis, number 2 nucleus solitarius, 3 nucleus salivatorius superior. Sensory and parasympathetic fibers together has name, proper name. This is nervus intermedius. I put here number 4 because nervus intermedius together, it pass together with facial. No, in general, whole this nerve is facial nerve. But sensory and parasympathetic fibers, that is nervus intermedius. Number 5, that is facial canal. 6, stylomastate foramen. And motor fibers pass through whole this canal, leaves stylomastate foramen, goes to parotid gland, makes plexus parotidus, and continues to all muscles of facial expression and supplies them. The same, this motor fibers supplies one muscle in middle ear. This is stapedius muscle. I put here number 7, musculus stapedius, and this nerve is nervus stapedius. Then after it leaves stylomastate foramen, it gives ramus auricularis posterior, number 9, and this ramus supplies musculus auricularis posterior and venter accipitalis of musculus epicranius. The same, it gives ramus digastricus, digastric branch, and it supplies venter posterior of digastric muscle and stylohyoid muscle. And then number 11, that is plexus parotidus, and it gives ramus temporalis, number 12, ramus zygomaticus, number 13, ramus buccalis, number 14, ramus marginalis mandibulae, number 15, and ramus colli, number 16. Ramus colli goes to musculus platysma and supplies it, and all another muscle supplies all muscles of facial expression. It is good if you repeat names of these muscles. Next, sensory and parasympathetic. I said that it is nervus intermedius, and sensory fibers in the region of geniculum canalis facialis makes ganglion, that is sensory ganglion, ganglion geniculi, pseudounipolar neurons here, ganglion geniculi, and then sensory fibers leaves canal, and parasympathetic fibers continues into this nerve and together with sensory into this. These two nerves are what is last number? 16. That is why 17, that is ganglion geniculi. 17, ganglion geniculi. 18, that is greater petrosal nerve, nervus petrosus major. And 19, that is chorda tympani, tympanic cord, chorda tympani. Now, greater petrosal nerve. Greater petrosal nerve, nervus petrosus major, it goes into the canal. It is pterygate canal, canalis pterygoideus. Canalis pterygoideus. Maybe you remember where this canal opens. This is canalis pterygoidus here and here, and this canal opens into this fossa.
Fossa out pterygopalatine.
Yes, you're right. This is pterygopalatine fossa. This is pterygopalatine fossa. Pterygopalatine fossa. This is foramen rotundum. It opens into pterygopalatine. This is fissura orbitalis inferior, and here it is foramen sphenopalatine, which goes into nasal cavity. And this is canalis palatinus major. It goes to hard and soft palate. That is openings in pterygopalatine fossa. I put here numbers. 20, that is canalis pterygoidus. 21, foramen rotundum. 22, fissura orbitalis inferior. 23, foramen sphenopalatine, and 24, canalis palatinus major. And here in pterygopalatine fossa, we have a second branch from trigeminal nerve. This is fifth cranial nerve. It gives 25, that is nervus maxillaris. This nerve goes to pterygopalatine fossa, and here it gives zygomatic nerve. The same it gives infraorbital nerve. It gives ramus ganglionaris, and then continues into rami nasalis posterioris and nervi palatini. All of them branches from trigeminal nerve. 26 zygomatic nerve, 27 infraorbital, 28 ramus ganglionaris, and it gives 29 rami nasalis posterioris, and number 30 nervi palatini. And now great petrosal nerve. When it comes to pterygate canal, here it has name nervus canalis pterygoidi, that is 31 nervus canalis pterygoidi, and this nerve goes to ganglion pterygopalatinum, pterygopalatine ganglion, and from number 32 pterygopalatine ganglion, and from this ganglion postganglionic fibers goes to zygomatic nerve, and then it leaves zygomatic nerve and attached to another branch of trigeminal nerve is lacrimal nerve, the same from trigeminal. It is 33 lacrimal nerve, and together with lacrimal nerve parasympathetic fibers goes to lacrimal gland and supplies it. 34 lacrimal gland. The same postganglionic fibers goes to nasal cavity together with rami nasalis posterioris and goes to oral cavity with nervi palatini. That is all about great petrosal nerve. And last, chorda tympani. Tympanic cord goes to tympanic cavity, leaves this cavity through fissura petra tympanica, and where is blue pen? Aha, so well, this is tongue, that is tongue, and we have branch from trigeminal nerve, lingual nerve, nervus lingualis, lingual nerve, here from trigeminal, lingual nerve. This lingual nerve from fifth cranial nerve, 35 lingual nerve, it supplies anterior 2/3 of the tongue, anterior 2/3, and it supplies, it conducts general sensivity. What is general sensivity?